Good morning, ladies and gentlemen. The first speaker is Al-Jassar from Kuwait. He is professor at the Faculty of Medicine, Kuwait University, consultant gynecologic oncologist, obstetric and gynecology. His lecture is screening for cervical cancer. Has MEMAGO adopted? Please.
Thank you, Mr. Chairman. Assalamu alaikum wa rahmatullahi wa barakatuh. It's so a pleasure to be standing before you and to start this fruitful meeting for the coming 2 days. Thanks for inviting me and thanks for making me part of this meeting. I did ask for a mobile mic, but I don't know if it will work or not. Is it? No, okay, that's fine. So, I was being asked to give this lecture, which I can't stand by a podium. I have to move. Okay. The topic that was being given to me is like how to adapt, or do we adapt the screening in our region? Which, when I was being given this topic, I talked to David and Mahideen and asked them what exactly you want me to tell you or tell the audience. The country, the region is very, has a huge differentiation, and it's not a homogeneous financially as well as culturally, I would say. So there is a difference in different aspects in our region. I was being given also 20 minutes, which I think it's a lot, so we will be sticking on time. And I will give my time to Dr. Mahideen Saoud, whom I have to thank that I just realized this morning, I arrived early this morning, and I realized that I did not bring a tie, and this tie is his. So, the question is did we adapt for a cervical cancer screening? So I can have this talk to be done in 20 seconds, and the answer is no. But however, is what we want to know. إذا خلص ما اشتغل؟ Okay, go ahead. Whenever you're ready, just interrupt me, please. Okay, so what we have to do is first of all, I put a blank slide. I don't have anything to disclose, and the question is, do we really have to adapt? There are few topics or the few studies in the literature that I found in the region, not that many in it. So what I did is I'm trying to find out how many cervical cancer do we have in our region. And the only source that is easy for me yet is there is a huge variation is Globocan. What we have to know that MEMAGO or our MENA region has the youngest population in the world. So that part should be taken in consideration, because this younger population, you don't want to see them in the future with a cervical cancer. So as I mentioned about I got the information about Globocan. I do understand that Globocan is not 100% reliable. However, the point is to know how much cervical cancer we have in the region and how many new cases we have in each region. So I'm not going to list to you. You can see it in the slide in front of you. So of course, being in Egypt, I started with Egypt, and the Globocan stated that the new cases is ranked at 20th and the death is 17th. Now, when we see the different part of the world with a different part of the world in our region with the cervical cancer and where it is ranked, we always have to stop and think that the cervical cancer is the tip of the iceberg. So we have a big pyramid underneath, for which there is a cervical dysplasia, which is costing the patient as well as the system for money and time. So when we talk about cervical cancer is the end result of the disease. What happened? Okay, so
Hello.
So what I was telling you, that the cervical cancer is the top of the tip of the iceberg. So you have a huge number of the cervical dysplasia that we should take in consideration and not to focus. The outcome is the cervical cancer. Thank you. So I just feel better not standing by a podium. Yeah. So when we get to know this as a cervical cancer as the tip, so we have to think of things to prevent it. And how do we prevent it? There are different modalities by which you can screen the cervical cancer. We know the old way is the Pap smear, which is Papiniculai, which was back in the 1940s. And there are different ways of it. There is the visual VIA, the visual inspection of acetic acid, as well as the HPV testing. So you can see there the different countries in our region. And I was surprised when I found in Turkey that they ranked it 19. I have a big question mark, and I wish our Turkey colleagues to get that. I think it's too high for it as a 19th, especially that in our region is the only country, or the proper country setting from as a screening is Turkey. We know that in Morocco they have the VIA, the visual inspection, and Tunisia are producing this. Now the question is, should we invest on a vaccine, HPV vaccine, or should we invest on the on the cervical cancer screening? This question, I want you to think about it down the talk. This is when you see me stopping, because I see my name with the EL, and I tell them, like, my name is Al-Jassar, not EL. So whenever I see them, like, that's wrong. Okay. There is a nice study that Dr. Muhyiddin is part of it. It's by Sharma et al. That they did what we call cost effectiveness module. And what they found in their study, they used something that's beyond my knowing. It's like Monte Carlo model to know how do we need. The end result, they found the novel HPV testing strategy has a greater reduction in cervical cancer. Again, that's in Lebanon, okay? Where's the history coming from? Okay, so now in our region, did we adapt or not? We really don't know. So we ask the question is should we think, or should we invest in the cervical cancer or on HPV vaccine? That depends on each country, depend on your resources. Personally, I think if you have limited resources, investing in vaccination would give better yield. And I was so happy to hear the HPV. I did not know that the vaccine is being introduced in Egypt. That's a very soothing information. Yet, if you have enough budgeting, absolutely yes, vaccination is not enough and that's not a cause to prevent or to assure the patient not to go for screening. Again, if she received a vaccination, that does not mean that she should not go for screening. But if I have a limited resources, should I invest it on screening or should I invest it in vaccine? My humble opinion, I think it's putting that money in vaccination. In our region, in the GCC, the Gulf countries, most of the countries are opportunistic testing. Opportunistic means the patient goes to do their Pap smear. So the end result is I'm standing before you and I'm pushing for the HPV vaccine. I know that the second person after me will be elaborating more. And with that, I'm ending my talk, where we have 12 minutes more for more questions. And you will stick on time in Egypt, inshallah. Thank you.
Oh, thank you.